Butler Hospital's unionized workers have been on strike for more than 2 months now, marking the longest hospital strike in Rhode Island history. So joining me live in studio to talk about the strike and its impact on the local healthcare system is Marran, the president of Butler Hospital. Mary, thanks for being here.
Well, thanks for having me.
So just bring us up to speed where the strike and the negotiations stand right now. When is the next meeting taking place?
So at the moment, we do not have a next meeting scheduled. On the 11th of July, the hospital formally presented the union with its last, best, and final offer. It is an offer we're quite proud of, quite frankly. It's market leading. When you compare it to the recently settled Rhode Island Hospital Agreement, we compare favorably to that and in many ways exceed that offer. So we feel good about our offer, despite the fact that we've been running the hospital with replacement workers at great cost. But it's a good offer, and we would love to see the union settle this, take the offer that's on the table, and move on.
And how is this ongoing strike? You mentioned that you have temporary workers in the hospital right now, but how has this affected Butler?
Yeah, so we have reduced our capacity by nearly 70 beds, which we are licensed for 197 beds. We run 28 beds for the Kent Hospital in Warwick that are located at Butler. But we have a total of 70 beds offline. What that means essentially is patients are waiting for behavioral health services. That typically happens by backups in the emergency rooms across the state, including my own psychiatric emergency room. That also makes it hard for anyone to get any care. You will wait to get access to behavioral health inpatient beds. We've had weekends where we've had 70 people boarding in emergency rooms across the state. But this will affect your ability to get any health care because of the impact this will have on throughput, and is having on throughput in emergency rooms across the state.
Now, you mentioned the latest offer from the hospital, July 11th, something that you called competitive and market leading. Earlier today, we spoke with a nurse at the hospital who said that final offer doesn't benefit all workers. I want to play a piece of our interview. Take a listen.
You know, we're here to make sure that all of our members, especially the ones that are the least paid, are treated with fairness and kindness and respect. And this last proposal that they're calling it doesn't touch them, doesn't help them. It would drive a wedge between some of the earners, like the nurses and the mental health workers, where they did give us a little bit of a wage increase, but nothing for the people to bring them out of poverty. And you know, we're standing together. We are one unit. We are one membership, and we're fighting for each other just as much as we're fighting for our own families.
What is your response to hearing
that? So I would
that?
say that that's inaccurate. We have addressed the low-wage workers in this deal. We've raised our minimum to $18 an hour, which is 20% over minimum, and in fact will stay ahead of the increases that the state is bringing to minimum wages through the life of the contract. By the end of the contract, we will have, I believe our starting salary will be, this is 4 years, a 4-year deal. It will be just over $19 an hour. This same group has leading healthcare benefits, 0 premium healthcare benefits. The average Rhode Islander spends $500 on their benefits each month. It also includes a defined benefit retirement and a TSA that's funded for more senior staff. This includes our low-wage workers. 4 weeks within ratification, low-wage earners will receive up to 35% increases. So I just have to disagree with the nurse on that reflection of what the offer includes.
And as we mentioned, this strike has been going on for 2 months now. You mentioned there's no meeting scheduled at this point to bring both sides back to the table. It seems like you guys aren't really close to reaching a deal here. So where do you see this going from here? Is there an end in sight to this?
I actually think that's a question for SEIU 1199. There's a great deal on the table. They need to come and settle this deal. We need to open our hospital back up and stop holding behavioral health care hostage. The union is not spending enough time at the table. They're everywhere but. And from my perspective, this is more about union imperatives and less about my staff. The deal I have on the table takes care of everything the staff have asked for, from healthcare benefits to training to protections for injured workers. I think I've met everything they've asked, and I ask 1199 to come and settle this deal, market leading for behavioral health, where we don't have the same revenue as general medical facilities. In fact, we're behind in revenue. We don't get paid the same as NICUs and orthopedic surgeries. So I ask 1199 to come, be reasonable, sign this deal, and I invite any one of my workers to come back. They're welcome back anytime. They can come back whenever they want. We want them back. They're the best people to take care of our patients. It's time for them to come back to work.
Unfortunately, that's all the time that we have here, but we will continue to track this story and this strike as it continues. Mary Marran, the president of Butler Hospital, thanks so much for your time.
Thank you. I really appreciate the time. Thanks.
And looking ahead to later in this newscast, Ed Fitzpatrick with the Boston Globe will join me live to talk about the controversial seawall at Quidnesset Country Club that's ahead around 4:40.